Welcome to our channel. Somatic healing, often referred to as somatic therapy or somatic experiencing, is a therapeutic approach that focuses on the connection between the mind and body to address and heal trauma, stress, and other psychological conditions. This form of therapy takes a holistic approach based on the premise that emotions and traumatic experiences can become trapped in the body, leading to both physical and mental health issues. Disclaimer: the information provided in this video is valuable but is for educational purposes only and should not be considered medical advice. Somatic therapy differs from traditional talk therapy. Unlike traditional talk therapy such as cognitive behavioral therapy, CBT, primarily focuses on changing thoughts and behaviors. Somatic therapy starts with the body. It cultivates an awareness of bodily sensations and teaches individuals to explore and release these sensations to achieve healing. This approach can be particularly effective for those who have not found relief through conventional psychotherapy methods. Key concepts of somatic healing: mind-body connection. Somatic therapy emphasizes the interrelation between mental and physical health. Psychological trauma and stress can manifest as physical symptoms, and addressing these physical manifestations can aid in emotional healing. Trauma and stress release. The therapy aims to release stress, trauma, and tension that have become locked in the body. Techniques used in somatic therapy help individuals become more aware of their bodily sensations and use this awareness to release negative emotions. Historical development. The concept of somatics was significantly developed in the 1970s by Thomas Hanna and Dr. Peter Levine. Levine's work particularly was influenced by observations of how animals recover from trauma and the idea that humans can get stuck in a freeze response, leading to prolonged stress and trauma. Techniques used in somatic therapy: breathing exercises. Controlled breathing techniques to help regulate the nervous system and release tension. Postures and gestures. Specific body movements and postures to facilitate the release of trapped emotions. Mindfulness and body awareness. Practices that increase awareness of bodily sensations help individuals feel safe in their bodies while exploring emotions and memories. Benefits of somatic therapy. Somatic therapy can be beneficial for individuals experiencing a variety of conditions. These include post-traumatic stress disorder, PTSD, anxiety and depression, chronic pain, complicated grief, trust and intimacy issues, self-esteem problems. Let's take a look at each one of these conditions in more detail. Starting with condition number 1, post-traumatic stress disorder, PTSD. PTSD often manifests physically. Tension, chronic pain, and digestive issues can deeply impact one's life. Traditional therapies like talk therapy and medication are common, but let's take the more uncommon holistic approach. Somatic therapy teaches techniques to regulate emotion. Practices like deep breathing and grounding exercises help manage intense emotions, providing a sense of control and stability. These techniques can be powerful in managing PTSD symptoms and reducing the frequency and intensity of emotional outbursts. One of the most common grounding techniques is the 5-4-3-2-1 technique. Start with searching for 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Practicing this techniques can help you get in touch with your body. Condition number 2. Both anxiety and depression often have physical manifestations like muscle tension, headaches, and digestive issues. Somatic therapy helps to release this physical tension, relieving these symptoms. Techniques such as deep breathing, body scan meditation, BSM, and gentle movement can help calm the nervous system, reducing the intensity of these physical systems. Body scan meditation is a mindfulness practice that involves paying attention to your body's sensations without judgment. Practices like grounding exercises and mindfulness can help reduce the severity of anxiety and depressive episodes, making it easier to navigate daily life. Somatic therapy teaches techniques to regulate emotions. Condition number 3, chronic pain. Chronic pain often results in muscle tension and stiffness. Somatic therapy includes techniques like gentle stretching, body awareness exercises, grounding techniques, and mindful movement can help release this tension and improve mobility. Somatic therapy provides a comprehensive approach to healing. Chronic pain is often intertwined with emotional trauma and stress. Somatic therapy helps release emotional healing by addressing both physical and emotional aspects of pain. Condition number 4, complicated grief. Complicated grief is a prolonged grieving process where grief isn't naturally resolved, generally described when grieving continues to be intense, persistent, and debilitating beyond 12 months. Grief often manifests physically with symptoms like tightness in the chest, headaches, and muscle tension. Somatic therapy helps release this physical tension, providing relief from these symptoms. Condition number 5, trust and intimacy issues. Trust and intimacy are crucial components of healthy relationships. However, past traumas and negative experiences can create barriers. Traumatic experiences, especially those involving betrayal or abuse, can deeply affect our ability to trust others and form intimate connections. These experiences often manifest as physical sensations or reactions in our bodies. Simple practices like hand-holding, gentle touch, and shared breathing exercises can create a sense of safety and closeness. Learning to listen to one's body can make a huge difference in the ability to be intimate and open with others. Somatic therapy helps individuals become more aware of their bodily sensations and how their bodies respond to stress or triggers related to trust. By doing so, they can start to identify and understand their physical responses to mistrust. Last, let's take a look at condition number 6, self-esteem problems. Low self-esteem can affect every aspect of our lives, from relationships to career success. While traditional therapies focus on cognitive and emotional aspects, somatic therapy offers a unique approach by addressing the mind-body connection. Low self-esteem often stems from negative experiences, criticism, or trauma, which can create deeply ingrained patterns of self-doubt and insecurity. These experiences manifest not only in our thoughts and emotions, but also in our bodies. By using techniques like deep breathing, body scan meditation, and mindful movement, individuals can process and let go of the physical manifestations of past negative experiences. In summary, somatic healing offers a holistic approach to mental health by addressing the physical manifestations of psychological trauma and stress. By integrating mind-body techniques, somatic therapy helps individuals release trapped emotions and achieve overall well-being. While more research is needed to fully understand its efficacy, somatic therapy provides an alternative pathway for those seeking relief from trauma, anxiety, and chronic stress. Thank you for watching. Don't forget to like, share, and subscribe for more insights on health equals wellness. If you have experienced the healing benefits of somatic therapy that might benefit someone's health journey, please share in the comments below.